hesitancy, and I'm not sure you can answer this question, but enough hesitancy out there that we don't achieve herd immunity by June or July in the bulk of this country?
Absolutely, there is enough hesitancy to put a damper in those plans. So if we think we hit herd immunity at 70% of the population, assuming we have 35 million people in the country, we would need essentially all adults to be vaccinated to reach that number, assuming kids don't get vaccinated. So we can't tolerate any adults, frankly, not being vaccinated. When we open this up to children, then the wiggle room gets a little better. But still, eventually, we're going to hit that wall of having more supply than demand. The USA might be there already, and that is definitely our future.
When you look at this, is this something that research can be done to see what communities have the highest levels of hesitancy? When you look at the information we received today, the bulk of these communities are in the Southern Health region of Manitoba. So can you go in and say, okay, let's see if it's a religious reason or if what other underlying circumstances there are? Or is it an economic or socioeconomic reason? Is that something that can be looked at not just here in Manitoba, but across Canada?
It's something that's looked at around the world, and the factors are multitudinous, as you can probably imagine. Interestingly, it seems that one of the biggest motivators to get vaccinated is the desire to protect other people. And that's inspiring. If you remind people that you don't get vaccinated for yourself, but for your community, that seems to put a fire under people to encourage them to go and get that protection. The other part of it is people are afraid of adverse reactions. That's understandable because they're real, and the media tends to inflate those handful of adverse reactions and underreport the good news that vaccination happens. For example, in Manitoba, 35% of the population has received at least one dose, and that's probably why the Manitoban third wave is not nearly as fatal as the second wave was. So selling that good news is important, right? And reminding us that we have modern civilization of an earth-girdling nature because of the public health adventures in clean water, antibiotics, and vaccination. So we have a civilization because of vaccination, frankly.
And it's true. We don't, as Richard likes to say, we don't report on the not that there's many these days, the planes landing safely at the airport. We tell you about the ones that don't. And similarly, we talk about, the one person in Quebec that died of the blood clot, because we need to tell people that. But you're right. There's many more positive stories out there. And we've certainly tried to highlight those as well. But does messaging need to be different and targeted differently to, say, someone like you and I versus someone who lives in the Southern Health region of Manitoba versus someone who lives in the core of downtown Winnipeg?
Yes, we must tailor-make the messaging for specific demographics, reminding us as well that people don't process risk through their frontal portions of their brain, through the rational thinking parts of their brain. They process it through the limbic system, the emotional reptilian parts of our brain. So stories matter, narratives matter, telling people about the people who got vaccinated in their community and nothing bad happened to them. And in fact, they're out having great social lives now because of it. Whereas if we tell them stories about the people for whom bad things happen, they fixate on that. So comparing risk to things that we understand. For example, the risk of a clot from a viral vector vaccine is similar to the risk of going blind from Viagra. Right? So, and yet that hasn't stopped people from prescribing or accepting Viagra. Or we wear the seatbelt every day on our cars, and yet the risk of anything bad happening on our daily commute is actually quite small, but we still wear the seatbelt. Right? So vaccination is kind of similar. We take the precautionary measure even though the risk of something bad happening is small. There are many ways to contextualize this messaging, and we've done a poor job so far, but focusing on numbers doesn't tell the story. We focus on narratives and examples and analogies instead.
And local influencers are so very important, especially in rural communities and inner city communities. With us on 680 CJOB from the University of Ottawa's epidemiologist Raywat Deonandan, Richard and Julie with you. Province announcing today 189 cases, 124 here in Winnipeg. Of the three fatalities, two involved people in their 20s. One had an unspecified variant. That in itself is unsettling. But as you look at the numbers here, what is this telling you, Raywat?
Well, it tells you that the variants have arrived in Manitoba, as we all knew that they would. But still, Manitoba is doing fairly well compared to the rest of the country. Your first wave was a pittance. The second wave was pretty pretty brutal. Your third wave looks to be peaking below where the second wave was, which is not the same story you see in places like Ontario, where the third wave is just out of control, or was out of control, frankly. But across the country, we seem to have peaked, I'm hoping, knocking on wood here. And I think Manitoba is in the same boat because of those places that acted when they should have acted, if not a bit too late in terms of applying economic restrictions. It looks like the disease is slowing, which is good. So it's going to take a while for that slowness to manifest in the ICU occupancy, because that's a lagging indicator. So this is good news, but it's not perfect news. We still have to buckle in and ride out the suffering that's going to come for the next couple of weeks.
I think a lot of people looking at the numbers today, we're still, close to 200 cases, but for the first time today, the test positivity rate, although it's high in the, 8% range, didn't change. Is that a good sign?
It's always a good sign. Now, of course, day-to-day changes should be roundly ignored because there's enough noise in the system that we care about week-to-week changes instead. But it is a good sign that you're at least not getting worse, at least, on a day-to-day basis. And again, I feel that we have probably plateaued in Canada overall, with some exceptions. But we have to drive the numbers down further because this is not a good place to plateau. This is not a sustainable place to plateau. So in Ontario, for example, we had 4,000 cases a day. Then now we have close to 3,000. We'll have 2,000 soon. Each one of those days that it goes down is good, but that number of cases is still a large number of people suffering. So we have to drive it down further. In other words, congratulate ourselves for slowing it down as much as we have, but the job is not done yet.
All right, quickly, as influencers, have you had your shot yet?
I have not, for a variety of reasons, some medical, some circumstantial, but I really want it so badly. Do not doubt that. I really want a shot really badly.
I know you do. I've had mine. I think, Richard, you're scheduled for yours?
I'm scheduled Monday.
Monday. Okay. So we'll see how you're in fine form then on Tuesday. So thanks as always, Raywat Deonandan, for joining us here on 680 CJOB. In 10 minutes.